These are desperate days in New York. With more than 3,500 new cases in the last day alone, medical facilities are critically overstretched. A long line of worried people wait outside this hospital in the borough of Queens just to be tested for the virus.
Almost any scenario that is realistic will overwhelm the capacity of the current healthcare system.
That's why the authorities are drastically stepping up their response. This hospital in Manhattan is setting up a makeshift morgue, getting ready for a wave of deaths.
A morgue? That's creepy. That's creepy.
On a temporary morgue? Oh, God. I don't know. It's awful. It's awful.
Well, I'm scared to be here. That's why I'm obviously wearing a mask.
A determined President Donald Trump insists the battle will be won.
We are waging war on this virus using every financial, scientific, medical, pharmaceutical, and military resource to halt its spread and protect our citizens. I know that we will achieve victory and quickly return to the path of exceptional health, safety, and prosperity for all of our citizens.
Other emergency measures include this 1,000-bed US Navy hospital ship, due to arrive in New York Harbor on Monday to ease the pressure on the city's own hospitals. Normally packed Times Square is now eerily deserted, with no tourists in town and New Yorkers heeding a government ban on working and socializing in public. A city already in fear knows that the worst is still to come.
Let's check out the situation then in the US with DW correspondent Oliver Salet in Washington. Welcome, Oliver. Why is President Trump so confident this crisis will be resolved soon?
Well, Phil, I'm not even sure he is that confident, but what he's really trying to do here is to sell hope and optimism to the American public, of course, and also to the American voters, because he knows that his re-election is at stake. And, you have millions of Americans who feel very much insecure at this time, are scared, of course, of the current situation of unemployment, of the spreading virus, the pandemic. And so every day President Trump delivers this press conference in the White House press briefing room that, by the way, he hardly ever used in his presidency, and that he's now turned into something like his campaign rally, if you will, with the major message being always like, it's all going to be good, it's all going to be okay, we're going to go back to work soon, and the stock markets will go back up again. That's another very important aspect, of course, here in the United States. So experts and his own health experts in the White House see that differently, but his voters like it, and you can see that in the job approval rate of President Trump. That's as high as it has never been in his presidency.
And the US, like the rest of the world, is facing an economic crisis. Unemployment claims that last week were the highest recorded ever.
Yeah, that's right. And we're now in a situation where more than 3 million Americans filed unemployment. But there are some respected economists who believe that this is not just the beginning, that this number could go up to 46 million within this crisis. So the worst is certainly yet to come, not only with regards to the pandemic, but also with regards to the economic fallout of the pandemic. And that's, again, very threatening for Trump's re-election bid, because he's always made the case that this is the most successful economy and the most successful stock market of all times. This is basically essentially Trump's take and why he should be re-elected. But this all is turning into the exactly opposite.
Except that they have pumped an unprecedented $2.2 trillion into the economy. Well, this is the hope anyway, this rescue package that cleared the Senate and is expected to be voted on in the House on Friday. Is this going to be enough to ease the strain, not just on the health system, but on the whole of the US economy?
Well, right. It's again an unprecedented sum, money that is urgently needed, and as you say, is mostly needed as a kind of emergency relief. So to compensate people and businesses that are suffering from this situation right now, from the lockdowns across many economic centers in the United States. But if you look at the health system, that in particular in the epicenter in New York, that many health workers there describe as catastrophic, where fridge trucks are used right now to store the bodies of deceased patients in the hospitals, well, then money, of course, is necessary and would help, but only if the necessary material is available. And New York's Governor Andrew Cuomo desperately is calling for 40,000 ventilators, for instance. He's also stressing that the healthcare system is running out of supplies very soon. So money is certainly not the only problem here. It's also the fact that the material is not available on the market.
Oliver Salet in Washington, thank you. Well, half of the world's more than 500,000 confirmed coronavirus cases are here in Europe. So this crisis is likely to hit the bloc harder than the previous economic and migration crises. The European Central Bank's already announced unprecedented action to support EU members and businesses, but member states can't agree on how to distribute the financial burden, and this is resurrecting old fault lines between North and South.
Protective gloves, now a regular feature in the European Parliament. The Assembly is largely empty. MEPs who do attend are taking extra precautions. On the agenda, forging a common EU response to the coronavirus crisis.
When Europe really needed an all-for-one spirit, too many initially gave an only-for-me response. And when Europe really needed to prove that this is not only a fair weather union, too many initially refused to share their umbrella.
An umbrella some EU members remain reluctant to share. That includes von der Leyen's home country, Germany, even as the pandemic storm intensifies across the bloc. Thursday's 6-hour video conference with the EU's 27 national leaders ended without agreement on just how unified the economic response should be, especially when it comes to sharing debt across the Eurozone.
We reject communal debt. This is an old system that has not been used in the past.
The countries hardest hit by the pandemic so far, Italy, France and Spain, are among 9 EU countries in favor of so-called corona bonds. Opponents, including the Netherlands and Finland, prefer the European Stability Mechanism, set up in 2012 to respond to the euro crisis. The ESM can lend money to members in trouble, but with strings attached. Now Eurozone finance ministers have 2 weeks to figure out the details, a long time in the life of the rapidly spreading virus.
Let's go to Georg Mattes. He's following developments for us in Brussels. Georg, we had a pretty strong condemnation there today. Where does Ursula von der Leyen, where does she see this lack of solidarity now?
Let me give you 2 examples, Brent. One is the export of those essential masks, but also protective gear for doctors. And that export did not take place. Italy, for instance, needed those masks, and they did not get them from a fellow EU member state, but in the end they got them from China. Another example is the closure of national borders at a time of crisis, creating traffic jams, risking the frequent flow of goods in the internal market. And that is why Ursula von der Leyen has said, let's coordinate all of this, let's make a European stockpile, let's also make sure we close the external borders so that internal borders can remain open.
Okay, those are her suggestions. What came out of the video conference today? Were there any solutions that were offered?
It looks like we're having a row here over the financial means to help in the corona crisis. In other words, help the economy. There's a draft conclusion of this virtual summit, and in it says the European Stability Mechanism should be used and finance ministers should look into that. There is, however, no mentioning of so-called corona bonds or mutual bonds in the EU, because behind the scenes already the Netherlands, but also Germany said they do not want these bonds. They still believe that nations in Europe can get debt from the debt market, so they are still stable, and so those means are not necessary yet. And the Italian Prime Minister, in the meantime, has already said he has rejected those draft conclusions, and he has given the EU 10 days to come up with an adequate plan how to financially secure the future of Europe.
Yeah, it seems like we're going from one crisis to the next at the moment. Georg Mattes on the story for us in Brussels. Georg, thank you.
Well, let's take a look at some more of the latest developments in the coronavirus pandemic. 3 months into the outbreak, and the total number of confirmed cases has passed 500,000. The death toll is more than 24,000. France has reported the fifth highest number of COVID-19 deaths, and its death toll is still climbing. It's jumped by a quarter in just one day. And German company Bosch says it has developed a coronavirus test for use in medical facilities that delivers results in 2.5 hours, twice as fast as other tests. Well, the virus poses a particular danger to people living in Greece's overcrowded migrant camps. On Lesbos and on other Greek islands, tens of thousands are packed together in squalid conditions with little health care. An outbreak could be devastating.
Lesbos a few days ago. Migrants sew face masks, offering protection to others in the camps here as well as new arrivals. Now, though, the island is in lockdown. Built to house 3,000, 20,000 people live in this camp. Now it's cut off from the outside world. Peter Cesar from Doctors Without Borders says his organisation has long been calling for an evacuation, and now things are much worse.
They know they are trapped, and they know that there are no measures taken by the authorities to protect them against the virus. And that's another issue. So there is a real threat that this will be a medical and a humanitarian catastrophe. But there's also the fear that is going on, and we might see a lot of panic.
Hygiene is a big problem here, and with social distancing virtually impossible, any infection would spread extremely rapidly. There are just 6 intensive care beds in the island's main town. The very weak and sick, including chronically ill children, would need to be transported to the mainland. Germany's SPD party has appealed for action. Germany and some other European nations have offered to start by taking in around 1,500 people, mainly unaccompanied or sick children. It's just an initial step, and it now needs to happen very quickly. The European Commission is responsible for coordinating it all. An evacuation would be quick to organise, says migration expert Gerald Knaus. There are 800,000 beds in hotels in Greece, with only around 7,000 in use. 10,000 people on the islands could be accommodated on the mainland. The International Organization for Migration is now building temporary, safer camps to move people to. Yet so far, there's been no evacuation. It's time for European solidarity, says Knaus. Those with refugee status living on the mainland could be taken in by other EU countries, with all the accompanying healthcare protection they offer. MEP Eric Marquardt has been on Lesbos for several weeks. He's been documenting the inhumane conditions of the camps. The EU Commission must coordinate the quick evacuation of people from refugee camps to individual member countries, and we must work out how to ensure that hygiene and medical standards are adhered to. The EU Commission says it hopes that countries will be able to begin taking in children within the next few weeks.
Well, South Africa has confirmed its first 2 coronavirus deaths as the number of confirmed cases rises to more than 1,000. The news comes at the start of a 3-week nationwide lockdown to stop the spread of the virus. The military's been deployed to help enforce measures that include restrictions on people leaving their homes for anything but essential trips. Alcohol sales and dog walking have also been banned. DW Africa correspondent Adrian Kriech joins us from Cape Town. Welcome, Adrian. What's it like there on day 1 of this lockdown?
Well, Phil, you can see it behind me. It is empty. I'm on normally one of the busiest streets in the center of Cape Town, on Long Street, and there's almost nobody here. Everybody is forced to stay at home, as the sign says right behind me. This is the order for the next 3 weeks, and it will be enforced according to the president and his ministers. Nobody is allowed to leave the houses, only for essential services. If you go to a supermarket, for example, but you're not allowed, not even alone, to walk around, to go for jogging, to walk your dog. This is all forbidden. So it's 3 very tough weeks ahead for South Africa, but it is a necessary step, the president says. Looking at the numbers, how they are growing, they have reached more than 1,000 corona cases today.
So, following on from those numbers, how is the country's healthcare infrastructure coping?
Well, at the moment, it is still coping rather well, but this is at the moment. The reason why President Cyril Ramaphosa took the decision was quite clear. He knew that the health system is likely to collapse if the numbers continue to grow the way they have grown in the past days and weeks. 80% of South Africa's mainly poor population is catered for by the public health sector, and it's already now overwhelmed in the townships where millions of South Africans are living in very bad conditions. Access to healthcare is a massive problem, and it's going to be a worse problem in the weeks to come. Experts predict that the number of cases will still continue to grow for at least 2 weeks, and then hopefully we will be seeing a decline, and that hopefully will give the health sector a chance to recover and not be totally overwhelmed.
And all this in a country that was already in recession with an unemployment rate of 29%. What's being done to lessen the economic impact of this crisis?
Absolutely, Phil. More than every second young South African is already unemployed now, and it looks very bad for the future of the country, depending how this lockdown will work or not work. Many people here have the feeling, with the support of the government, they came up with a number of packages to support small businesses. The economy could survive for the 3 weeks, but it is not clear if maybe it could be extended in the future after the 3 weeks. It is not successful. Nobody knows how things develop afterwards. Will tourists really come back right away? Remember, the country heavily relies on tourism, which brings a lot of income, and at the moment that sector is basically dead. Hotels shut down, restaurants are shut down, so the outlook is not very positive at the moment, but South Africans still remain optimistic that things will get back to normal after this lockdown.
Thank you for that. Adrian Krish in Cape Town.